The number one reason you need a dental crown is probably not what you think. It's not because your tooth broke and then now you need a dental crown after it broke. You need a dental crown to fix it before it breaks. Here's an example of two different teeth. This tooth here has a crack in it, and also this tooth has a crack in it. The difference is this tooth needs to be extracted and this tooth just needs a simple dental crown. Now this one, we basically waited too long to do the dental crown, or the patient waited, or they're waiting for their insurance to cover their dental crowns. This is very, very common for people, but the reason why this one needs to be extracted is because a crack extends below the gum line. And if you have a cracked tooth that goes below the gum line, there's nothing any dentist in the entire world can do to save your tooth. We just need to extract it. Now, how do you know this is happening? You're gonna have like a sore tooth. It's gonna be uncomfortable to chew on. You could have an abscess, a gum infection. You could have all sorts of symptoms associated with this type of tooth, whereas this one, you just need a dental crown. Most patients think that you need to wait to have a dental crown because your tooth is broken. But when your tooth breaks, you're having all sorts of problems. Like you're having trouble chewing, the teeth next to it are having more pressure on them, and it's too late. And it's sometimes, if this happens and it goes below the gum line, we just have to pull the tooth anyways. So you get a dental crown for the reason that you're probably not really aware of. You get a dental crown, in my opinion, before the tooth breaks. And now every dentist is different. Some dentists will wait till they break to do them, but the problem is if you wait till the tooth breaks, you risk a bunch of things happening. There are two major risks for this. Number one is that if the tooth breaks and it goes below the gum line, we have to pull the tooth. So I don't like taking that risk. I like crowning teeth before they break so that you don't have to worry about pulling a tooth, getting an extensive bridge, an expensive dental implant. You can just do a simple dental crown that is like a 30-minute procedure. In my office, you get numb. It's about a 30-minute procedure in and out to get a dental crown, and it is much, much cheaper than getting a dental implant or going through that entire process of pulling your tooth out. Another reason why you need a dental crown is to do a dental crown before your tooth hurts. I'll give you a couple examples here of when it is too late to do a dental crown, and also when you should do a crown before the tooth hurts. Now, if the tooth is hurting, it may mean that that crack is actually going below the gum line or extending inwards of the tooth. Now, if you have a crack that goes inwards into the tooth, the risk is you're gonna get into that inner part of the tooth, which is the nerve. That is where all the pain is coming from on the tooth. And if you have a cracked tooth and it goes down or it goes into the tooth, it's going to hurt. So sometimes if you wait to crown a tooth, when it breaks, you are risking either a root canal and a crown. That's just an added expense. Nobody likes to do root canals. Everybody's worried about those. But also if you wait till that gets in there, it may be very difficult to restore. Another reason why it is very risky to wait till your tooth breaks to do dental crown is because the dentist doesn't have a lot of tooth structure to work with. A lot of times patients will call me 2 years later and say, "Hey doctor, my tooth broke like you said it was going to. I'm ready to do the dental crown." And I look at the tooth and I say, there is nothing left here. The tooth is broken down so far, all we can do is pull it. This is an example of a tooth that broke. It had a big cavity in it, and the tooth structure is so little that there's nothing to hold on to for a dental crown. So in this case, we just have to pull the tooth. That's an expensive implant, and then you're missing the tooth for 3 to 6 to 9 months. Honestly, it's just kind of a big hassle, so I always try to do dental crowns before they hurt or before they break. Now here are a couple of examples of exactly what to look for on why we do dental crowns. Like if you have a fracture on a tooth, this is kind of what it looks like. This is a big nasty fracture on the lingual or palatal side of the tooth. That is the tongue side of your tooth. Now this is a biting surface of the tooth, and where the tooth has been biting on the opposing tooth the most. The opposing tooth is the bottom tooth. This is the top tooth, and it's got a big old crack in there. And so it's been worn down to the point where it has an abnormally dark, deep fissure or a fracture on the tooth. And this is a perfect example of why we need to crown this tooth now before it hurts. Another thing is that when you have abnormal wear on your tooth, and you have fractures going all over the place, and and it looks to me like your tooth is just about to break, that is the perfect time before it hurts, before it's broken, and before you have any symptoms, because if you wait, there are consequences like I talked about before. One of the biggest factors too is which type of tooth we're going to crown before others. What I mean by that is your back teeth have a massive ability to kind of bite down. The farther you go back in your mouth, the more biting force you have. So if you have a tooth that is fractured or broken or about to break, it's starting to become a little bit cold sensitive, you need to get a crown on that tooth, because if it's on your back tooth and that's happening, that is a huge deal, because that's where all the power is on your mouth. That's where you can bite the most. You have the most biting pressure. Now, if it's on a front tooth or a canine and you're not even biting on it, like your lower tooth isn't even hitting it, that is much less of a risk for me. So I'll be a little bit more conservative in diagnosing that tooth. So if you have a tooth on a back tooth that has the same type of fracture as one on, let's say, a middle tooth or a front tooth, I'm much less worried about the one that has less biting pressure, which would be towards the front of the mouth. Another thing that complicates this is that patients have bruxism, which is nighttime grinding. If you're stressed out in your job, you just have these big jaw muscles and you're kind of clenching and biting your teeth all day, that is an indication that you're probably going to need more crowns more aggressively than if you don't have a biting issue or a bruxism issue. So if you're not grinding your teeth, you're much less likely to break your teeth at night and have issues with your teeth. So for example, if I have two patients with a cracked tooth that looks like this, one patient just has a very, very light biting pressure and doesn't grind their teeth. The other person does. I'll be a little more aggressive and I'll recommend a crown sooner for this patient than this patient. I'll be a little bit more worried that this patient's tooth is going to break and it's going to hurt. They're going to need a root canal. They're going to need to pull the tooth than I will with this person. So grinding your teeth has a huge impact on whether you need a dental crown sooner or later, or even need a dental crown at all. Another thing is if you have a cracked tooth and no opposing tooth, you don't need a dental crown. And I'll see this from time to time. Dentists will recommend these crowns and you absolutely don't need them. If you have a top tooth with a crack in it and it's cracked because it's had a lot of biting pressure, but it won the battle with the lower tooth and the lower tooth cracked, it broke, and you have to pull out the lower tooth, that top tooth doesn't bite on anything. There's no reason to fix that tooth because there's no harm being done with it just biting the air. So that's another thing to watch out for. If you don't have an opposing tooth or a tooth that complements that tooth that bites on it, like an upper tooth that meets no lower tooth, you don't need a dental crown. Another big factor is your bite being off too. You would need a crown sooner, and I'd be a little bit more aggressive with treatment planning a crown on you if your bite is off. Like let's say I have patients come in all the time where we check their bite and they're only biting like one tooth on the left side and like 5 teeth on the right side. Their bite is totally off. And when your bite is off and you don't have harmony, you're going to need dental crowns on those teeth sooner if you don't fix the bite. Now, the best thing to do is to fix the bite. That'd be Invisalign, clear aligners, that'd be maybe braces. But if you can't fix it in that manner, you're gonna need a crown on that one tooth. If you're only biting on one molar on the left side, you're going to need crowns on those teeth more immediately than you will on the right side. So everything being in harmony is better, and we want an even bite on all the teeth. Now, when we do a bite map of the teeth, what we're looking for is little pinpoints where the teeth are touching. We're looking left side versus right side, front versus back. We don't want a lot of biting in the front teeth, and I see that very, very commonly. As we age, our bite kind of goes forward, and you're slamming on those weak teeth that have weak roots, and you don't want to be biting on those front ones. So if we start to see fractures and breaking teeth on your front teeth, we kind of immediately go into action and crown those teeth. Another thing is that, and speaking of crowns, something that I get all the time is patients always ask me, why can't I just put a filling in it? Now, the reason they're asking that is because fillings are maybe 10-minute procedure, maybe a 20-minute procedure, and fillings are a lot less expensive than crowns are. Crowns are very, very expensive, even if you have dental insurance. Sometimes even the dental insurances won't cover crowns, so people have been burnt and they just want you to do a filling. I can do a filling on the tooth, it's just not going to last. A filling on a tooth that needs a crown is going to be bad news in the long term. It's great for a short-term solution, especially if you have like a big cavity. We want to arrest the cavity, we want to stop the cavity from progressing. But if you do a filling on a back tooth, for example, and you think that that tooth is gonna last at all, it won't. It is going to break and fracture just like in this picture, because you're basically taking a tooth and putting a filling material which is very, very weak, and the tooth colored composite fillings that we do very commonly now are very, very weak, so you don't want to put that on a back molar that needs a crown. Putting a filling into a area that has a crack is not a very good idea, just in my opinion. People will argue this with me, but in my experience, I've seen dentists do this over and over. And it'll last a year, it'll last 2 years, and then that filling will break and you need a crown anyway. So I don't like the patients paying double, coming in, getting numb, doing a filling procedure, then a year later they need a crown. It's more money for the dental office. I just don't like people going through that. So I always try to shortcut that and just, hey, let's just do the crown now rather than do the filling now and doing the crown later. Some dentists like that because they get paid for both procedures. I don't like that because it's twice the procedure and it's twice the money for the patient. I don't really like that. Just do the crown. The other thing is the silver fillings is probably the #1 reason that we do dental crowns, right? Back in the day, they did a lot of silver fillings, and these silver fillings are just so hard. The tooth structure, it cannot support the silver filling. A lot of times when a tooth is broken, the silver filling looks perfectly fine, and there's nothing wrong with the silver filling. It's actually intact. It looks like it was just placed yesterday. And the problem with this is that if you have a material that is harder and stronger than your tooth structure, the outer part of the tooth structure is going to crack and break at a higher rate than if you put a composite or tooth color filling in there. And what I mean by this is if you have a big silver filling in there, the silver fillings are basically an undercutting of the tooth. So when we put a silver filling, what you see on the surface is about half the surface area of you seeing underneath there, because we basically go down and we undercut to get that filling to stay in there. Now, tooth color fillings just stay in on their own. They're actually bonded to the tooth. So the old amalgam silver fillings that maybe your parents have and maybe you have in your own mouth are high likelihood of needing crowns in the future, because you have like this shell of a tooth that is very, very weak, and now you've put a harder material in the middle. And I rarely see teeth that are broken with silver fillings where the silver filling is broken. Now, if you broke your silver filling, there's a major problem there, because I always see broken teeth that are because they had a silver filling like years and years and years ago. Also, if you have these silver fillings that are very, very wide and very, very deep, the chances of you needing a dental crown in the future and or that tooth breaking are extremely high. I have a saying in my office sometimes, and I tell patients they can really relate to this, that silver fillings grow up to be crowns. And that's absolutely true, depending on the size, depth, and the width of the silver filling. But also, if you're grinding your teeth at night and have all these other factors, you could probably more likely need a crown there than somebody else who doesn't grind their teeth and they've had a white filling put in there or a tooth colored filling that is much more conservative. And one of the last scenarios I see in my dental practice all the time, and I tell patients, is that if you are missing a tooth, let's say you're missing one molar on the left side, right? What's gonna happen is the adjacent teeth are now gonna have to be biting that much more pressure, maybe up to 25% more biting pressure on those two adjacent teeth. And what you're gonna do is you're subconsciously going to be chewing on the right side. That's going to do two different things. It's going to cause more pressure on those adjacent teeth near the missing tooth on the lower left, but it's also going to subconsciously make you bite harder and more on the right side. That's also going to be a problem. Now what you're going to see is you're going to see more fractures, more abfractions, and abfraction is basically on the gum line where your tooth it looks like a little beaver has kind of chewed in on your tooth on the outside of the tooth, and that is going to mean you're going to need more dental work on the right side than you will on the left side, just because you're like at night, you're kind of grinding on the right side more. In the daytime, you're subconsciously chewing on the right side more, and it's just going to throw things off. So it's another situation where it's very important to replace that one tooth down there, a dental bridge, a dental implant on that left side, so that you're not grinding the heck out of your teeth on the right. So I do see that the teeth are not always, everything in the mouth needs to be in symmetry, and your left and right side kind of need to be the same and bite the same, and then you're going to be in harmony and you're going to need less dental crowns. So don't wait to get a dental crown until it breaks. Don't wait to get a dental crown before it starts hurting, because then you're at a high risk of a root canal. Go seek a dental professional if you want to get help with this and ask their opinion about this. This is just educational material to help you decide on whether you need a dental crown or a filling, and help guide you into maybe a more informed decision. I'm not diagnosing your tooth. Your dentist can do that. You need to go see your dentist. Don't self-diagnose yourself. This is just educational material. But I hope this information helps and you learned a lot. And if you did, write a comment below and subscribe to the channel, and I will see you for the next video. I'm just a dentist, and thank you for watching.